Let's get started with the presentation. Today's overarching topic is advancing care and advocacy, medical, legal, and community support. Our first presentation today is the future of LGBTQ plus health and advocacy. Where do we go from here? Presented by Alex Sheldon, MA in International Human Rights and Executive Director of GLMA. Alex is the Executive Director of GLMA and a professional researcher, strategist, and advocate with over 15 years of experience in the field of human rights with a concentration in LGBTQ plus rights. Prior to joining GLMA, Alex was the head of research and social impact at an LGBTQ plus startup company where they specialize in economic inclusion for LGBTQ plus people. Previously, they served as a deputy director of the Clinton Global Initiative at the Clinton Foundation, and they held roles at Everytown for Gun Safety, the Movement Advancement Project, and several international nonprofits. They received an MA in International Human Rights with a concentration in Global Health Affairs from the University of Denver, a BA in Psychology from Whittier College in California, and a certificate in Nonprofit Leadership and Management from the Institute for Nonprofit Practice. Alex is a returned Peace Corps volunteer and currently serves on the board of directors at the Equality Federation. Alex, I'm going to stop sharing my screen and then the floor is yours.
Great. Thank you so much, Kara, and thanks everyone for being here and good morning. I'm really excited to chat with you all today and to ground us a little bit in what moment we are in and what the future holds in store for us for the future of LGBTQ plus health and advocacy. So again, my name is Alex Sheldon. I use they, them pronouns, and I am the executive director of GLMA, and we also call it GLMA. So we used to be called the Gay and Lesbian Medical Association, and in an attempt to be more inclusive of LGBTQ plus identities, as well as other professionals in the health professions, we've changed our name to GLAMA, Health Professionals Advancing LGBTQ plus Equality. So today I'm going to take you through a few key topics that are really relevant to the current moment that we are in. First, I'm going to tell you a little bit more about GLAMA's work and how we are working in the space and in the environment that we find ourselves in now. We're going to go do a little bit of a dive into the moment we're actually in because we are on a precipice of change, and I want to talk through a little bit about what that looks like. We're going to explore some recent advancements in LGBTQ plus health so we know what's at stake. Then we'll talk about the federal and state attacks on care and the Project 2025 playbook that is behind all of those attacks. And then we will talk about how we can fight back as a group. So first, going into GLAMA's work, I've been the executive director of GLAMA for almost 3 years now. We were founded back in 1981. So we are the oldest and largest association of LGBTQ plus and allied health professionals who are dedicated to advancing LGBTQ plus health equity. Our membership today is larger than it has been in the history of the organization, speaking to the need of this organization in this moment. And we have thousands of health professional members all throughout the country, and they include physicians, nursing professionals, physician associates, social workers, therapists, counselors, researchers, educators, and more. Essentially, anyone who touches healthcare in any way is considered a health professional among our membership. And importantly, within our membership, many folks do work in LGBTQ plus health, but many don't. And that is because we have a dual mission. Our mission at GLAMA is twofold. First, it is to advance LGBTQ plus health equity, but it is also to ensure that LGBTQ plus and allied health professionals are supported in their work and learning environments. So just like our mission being dual-fold, I consider my job to consist of two main things. One, it's to channel the expertise of our membership to real gains, to make real gains in education, research, and advocacy that advance LGBTQ plus health equity. Essentially, to maximize the impact of our brilliant members and taking their change efforts to the systemic level. But my other job is to advocate for the rights of health professionals to do their jobs to the best of their abilities. And those rights are under attack right now. We know that health professionals need the freedom to be free from moral injury that happens when they have to choose between their jobs and following the law. So it is my job to essentially to hopefully and essentially to defend against some of the attacks on the health professions, and also ensure that they're able to use evidence and research and best practice to guide all of their care provision. So our work consists of three main areas. One is in education. So we are an accredited CE, CME, CEU provider, and we hold many different webinars, and we have on-demand CE, CME for all of our members. All of this is geared towards advancing LGBTQ plus health equity. So we have a lot of opportunities to look at systemic drivers of and social determinants of health, as well as key care provisions that ensures that we are looking at the unique health needs of LGBTQ plus people. And almost all of our work really culminates in our annual conference. So 2 weeks from yesterday will be our 43rd annual conference on LGBTQ plus health, and there is still time to register, and I will make sure that you get more information towards the end of this presentation. Another area within we work very closely with all of our membership as well as other experts in our space is in research. So a cornerstone of our research programming is the Lesbian Health Fund. That is the only health fund in the US and likely worldwide that is dedicated to funding research on the unique health needs of LGBTQ plus women and girls. Since the beginning of this health fund, since the creation of it, we have awarded over $1.2 million in research funds dedicated solely to that unique intersection. And our grants open up, the grant application process opens up in January. So I hope you all take a look and fund some great research, especially during a time where research funding, again, is under attack. And lastly, the other cornerstone of our work is in advocacy. So we have amazing relationships with other health professional associations, from the AMA to the APA to the AAPA and every acronym under the sun. And we are the only LGBTQ plus organization with a voting seat in the AMA's House of Delegates. So we work really closely with folks on the ground who are working within those organizations to advance LGBTQ plus inclusive policy, as well as informing care practice in that space. We are also involved heavily in the court system right now. I'm going to get into that a little bit later, but we are an organizational plaintiff in several key lawsuits that are challenging the unconstitutional restrictions on gender affirming care that have taken root throughout the country. And importantly for our membership, because we want to channel that amazing expertise that our members hold, we have incredible coalition work as well as very much real-time training and action alerts that equip our folks with these tools they need to take their expertise and turn it into effective advocacy skills. So wherever you live in the country, we have action alerts that go out to alert people that, hey, we need someone in this space who's able to go and speak to this with their amazing expertise undergirding their information. So I will talk a little bit more about how to get involved and how to fight back with our organization, but let's go dive into the actual content out and where we are today. So first, here is the moment that we are in. Right now, we are in an era of unprecedented visibility for LGBTQ plus people and our health issues and unique health needs. Our communities are more present in medicine, in policy, and culture than ever before. And yet, that visibility has sparked record levels of backlash, political, legal, and social, aimed at erasing and restricting our rights, especially in healthcare. So over the past decade, we have made incredible gains. We have had really meaningful victories in marriage equality, non-discrimination protections, political representation, and the list goes on and on. These gains have undoubtedly transformed lives and strengthened our systems, but every gain we made is now being tested by coordinated political attacks. So LGBTQ plus rights, particularly LGBTQ plus healthcare rights, are under siege from state and federal efforts to ban care, silence providers, and sow fear. But we are not powerless. We know that we are strong, interconnected, and we have a movement that has been built over decades. And we know that there are ample opportunities for us to fight back as long as we are still together to defend science and build an inclusive future. So I know right now it feels like we are being pulled backwards, and those feelings are very valid. Many of the important gains we have made are under attack. But one of my absolute sheroes in the movement, Nadine Smith, she is the executive director of Equality Florida. She has really helped. She has a way to reframe that feeling of being pulled backward. So rather than thinking that we are just simply being pulled backwards and losing ground, we like to think about this moment as a slingshot. So progress for LGBTQ plus rights can feel like sometimes we're being pulled back by setbacks, hostility, and political attacks. But that backward pull actually builds tension and energy, creating conditions for a stronger, more powerful push forward. So rather than thinking that we are just being pulled backward or being dropped off there, know that we are building the necessary momentum and tension and solidarity to rocket past where we were even before. Because unfortunately, even though we had many, many gains in LGBTQ plus health, we were building systems that didn't always work for us. There were policies that were limited or exclusive or didn't see our community and respect all of us on the same level playing field. So this is our opportunity as some of these things are being dismantled to build back even stronger. So really think about the moment that we are in as a slingshot, not as just a backwards trajectory, because every attempt to hold us back only strengthens our resolve, propelling our movement towards greater equality and justice in the future. So before diving into the hellscape that we find ourselves in, I want to ground us a little bit in the wins up to now. So we have had incredible gains in specifically in LGBTQ plus healthcare over the decades. First of all, in HIV, there have been innovations in HIV and STI prevention and treatment, including the introduction of PrEP, including daily pills and long-acting injectable options. We know that there are advancements in HIV treatment that have essentially turned HIV into a manageable chronic illness rather than the death sentence it was decades ago. And we have expanded STI testing and prevention programs that have been integrated into HIV and PrEP services. We've improved cancer screening and preventative care, and the protocols are now more inclusive of gender identity and sexual orientation than ever because there is widespread recognition that there are unique risks for our populations that need to be addressed in order to have equitable access to care. And many of our advocates in the space have developed inclusive guidelines for preventative care addressing those specific LGBTQ plus risk profiles. We've also seen, and I know that this is an area that is extremely under attack at the moment, but we have seen expanded gender affirming care throughout the last few decades. There has been widespread adoption of evidence-based standards of care from WPATH to the Endocrine Society. We've seen expanded access to gender affirming hormone therapy and surgical options. And importantly, thanks unfortunately, in large parts of the COVID pandemic, we've seen the use of telehealth platforms to provide, like, really expand the reach and access to gender affirming care in underserved areas. We've seen advancements in data collection and research, growing and diversifying our evidence base. There's been key investments in data collection at the federal, state, and local levels, as well as institutional levels, that have meant that the visibility into our unique health needs is at a level that we have never seen before. There's more funding and visibility into our health research, including the NIH, including from the NIH, which designated the sexual and gender minority research portfolio that, of course, now has been challenged. And we've seen the development of community-driven research partnerships, ensuring that lived experience actually guides evidence. And also importantly, and once again, something that is under attack are the policy and systemic advancements. In the Section 1557 of the Affordable Care Act, we reaffirmed non-discrimination protections in healthcare. We implemented SOGI data collection and EHR systems all across the country. And we've also seen the growth of LGBTQ plus specific health centers and clinics all throughout the country, and also an expansion of LGBTQ plus health curriculum in medical and nursing schools all over the country. But yes, these gains are under vicious and direct attack. We are living through the most politically hostile climate LGBTQ plus rights have seen in recent history. We have seen unprecedented attacks on healthcare, education, and also basic freedoms. Federal government agencies right now have been weaponized against our communities. And across dozens of states, lawmakers are advancing bans and rollbacks that are attempting to erase protections and silence providers who serve LGBTQ plus people. And what makes this moment so dangerous is not only the scale of these attacks, but the way they are coordinated to undermine the very systems like healthcare and civil rights law that our communities rely on. So here is just a snippet of some of the actions taken and statements made by the Trump administration aiming specifically to undermine LGBTQ plus healthcare. Now, I'm not going to go into detail on all of these because that is essentially an entire seminar on what is happening under the Trump administration, and that would take up the entire hour. Instead, I'm going to focus a little bit on some of the key things and key ways in which this entire political agenda has been advanced through the federal government. So first, we saw in late January, there was an executive order issued by the Trump administration aiming to restrict gender affirming care for those under the age of 19. So this was a very, very lengthy order that was laying the groundwork for the weaponization of government agencies to attack gender affirming care providers and those who receive that care. This one essential piece of this executive order was detailing the conditioning of funding for any institution that provides gender affirming care to those under the age of 19. That meant that any federal fund, any institution that receives federal funds could see all of that federal funding go away if they provide care to even one person under the age of 19. So that means in some cases, hundreds of millions of dollars in Medicaid and Medicare reimbursements and federal research funding could be gone overnight simply because they provided care to maybe just one LGBTQ plus young person. So the impact of this, of course, that would be a terrifying prospect for any institution, and it could potentially shutter entire hospital systems. So when this was released, we saw quite a few institutions cease care or pull back. Since then, we have challenged this executive order in court, and we won that case in court and received a preliminary injunction blocking the implementation of that conditioning of funding. But again, unfortunately, the goal of all of this is to sow chaos and to intimidate providers and their institutions into ceasing care before it is even made illegal. So if I impart any piece of information to our attendees today, it is that executive orders are not law. In fact, many of the executive orders coming from the White House right now directly contradict existing pieces of policy and law. They are illegal in and of themselves. That is why we are having so much success in the courts. We are blocking the implementation of a lot of these incredibly unconstitutional executive orders, and we are winning. But where we are losing ground is through the coercion and intimidation that is very much embedded into these executive orders. So we're seeing a lot of preemptive obedience and preemptive capitulation to what the Trump administration wants. At the state level, we have also seen bans on transgender medical care pass in over 27 states. You can see from this map here all of the states that have passed some form of restriction on gender affirming care for minors in orange, with particularly egregious attempts to restrict access to care, including charges of felony charges that come with providing said care that are highlighted with these little red caution marks. So you can see very clearly here, more than half of the country has passed very restrictive policies that limit access to gender affirming care for young people. So this is happening. We are seeing attacks on LGBTQ plus care at the federal and state level, and this has been taking place now for years. To implement the transphobic wish lists and anti-LGBTQ plus wish lists that I detailed in a couple of slides back, the Trump administration has, as I said before, weaponized multiple agencies to attack providers and hospitals and clinics for providing this care. The DOJ, currently led by everyone's favorite bigoted Barbie, Pam Bondi, have really sought to intimidate providers in their clinics and their institutions by issuing subpoenas and memos that are detailing a number of actions that they are willing to take against providers. We probably saw many detailed accounts of the subpoenas that went out to 20 different hospitals and providers throughout the country. What is really concerning about this is that they are investigating and are essentially violating federal patient confidentiality protections by asking for information that they should not have access to so that they could further target and intimidate young people and their families. the really important piece here is that gender affirming care in the places that they are being they're investigating is not illegal. So they are not investigating any sort of anything that was any illegal activity. They are investigating something that they want to be illegal. So on top of the Department of Justice, we also saw the Federal Trade Commission being called to action to convene and issue warning of investigations that would be coming, looking at gender affirming care as a case of deception. We've also seen consideration for two CMS, or Center for Medicaid and Medicare Services, two rules coming from that office, both of which are now with the Office of Information and Regulatory Affairs. One will aim to restrict the use of Medicaid funds for gender affirming care for minors, and the other conditions funding based on the provision of that care. So one is you can't spend this money on gender affirming care. That's very much restricted. And then the other is you can't provide gender affirming care at all if you want to receive any of these funds for any other type of care. So they are attempting to attack this from multiple different angles. The result overall right now is an incredibly hostile environment where quality care for young trans people and non-binary people is being held hostage by political actors in attempts to garner favor and amass more and more power for themselves. And unfortunately, in many ways, although the title of this article hurt on multiple fronts, and of course is wrong for many, many reasons, but unfortunately, the massive, widespread chaos and confusion and coercion on behalf of the federal government, they have been a little bit successful with this tactic, and many institutions have decided to cease care for young people. The most important piece here that I would like to take away is this does seem like a lengthy list, and unfortunately we see some major institutions that have decided to preemptively obey the whims of the federal government. However, the vast majority of institutions all throughout the country and states that haven't limited this care are staying the course. They will not capitulate, they will not preemptively comply, and they are standing their ground. Those include a lot of institutions like Boston Children's or Minneapolis Children's Hospital. They are standing up for trans young people, and they have said that they will defend their providers, and they will not capitulate, and they will not preemptively obey. So, but the effect on providers is very is taking. There are many, many tolls against providers right now. The chaos and confusion is so widespread. At what I hear from providers every single day in my role is that they have no idea what kind of care is allowed day to day. And many of these hospitals here issued public statements. Those are the things that are linked in in this slide. But most institutions that have ceased care have done so without any written notice. They are having meetings and asking that information about the cessation of care be spread by word of mouth. They're asking providers to cancel appointments with their patients without any warning and without actual justification. And so that means that, and also at some places, they are essentially making up new clinical guidelines to wean young people off of gender affirming care treatments. So they're essentially making up new ways to provide care that are not researched, have no evidence base, and are informed by people who have not worked specifically with trans folks. So on top of all of this, providers we know right now and providers I hear from feel hunted and persecuted and honestly feel terrified. And they don't feel like they can do their job and obey the law at the same time, or obey the policies that are being put in place by their institutions. But what is driving all of this? Because it's really important to understand what is driving this massive attack on our rights. We have to understand that in order to fight back. So here's the reality. We are not facing random policy skirmishes. We are facing a playbook. Project 2025 is a coordinated manual for an extremely well-funded evangelical conservative movement. It is designed to consolidate power in the hands of a few and to dismantle the rights and freedoms of the many. This isn't a disorganized culture war and the rhetoric that is associated with it is not disorganized. It's a calculated strategy. This is being coordinated across think tanks, political operatives, and billionaire and millionaire donors. It is backed by enormous resources, money, media, and infrastructure, all designed for one purpose: hoarding power. And when a small group is trying to hoard power, who do they target first? Obviously, they target the most vulnerable: LGBTQ plus people, women seeking reproductive health care, Black and Brown communities fighting for civil rights, immigrants and refugees seeking safety, people with disabilities demanding access. So they have started with these communities because they think that we can be isolated, because attacking the margins is how authoritarian movements gain momentum. They literally are counting on us to be divided. They've tried to convince parents that queer kids are a threat. They are telling people of faith that they have to choose between religion and equality. And they've essentially used race, gender, and sexuality as wedge issues that are aimed at one goal: to distract from the truth. That is, what they want is unchecked control. So first, naming Project 2025 and the architects around it for what it is the very, very first step. Resisting it together is the next, because when we stand united across race, class, gender, faith, we're going to strip away their power. So we need to make clear that there's no playbook that can outlast solidarity and resilience, that really underpins our movement and has for many, many decades. And that's essentially how we win. So for health professionals, I think the stakes are very, very clear. The attacks don't start with us, don't stop with us. Again, these attacks will not stop with LGBTQ plus people. They will not stop with providers. When they criminalize doctors for following science, the entire system suffers. If they can ban gender affirming care, they can ban reproductive care. If they can spread misinformation about Tylenol and acetaminophen, even though they can't pronounce acetaminophen, then they can target any other treatment and claim that it has adverse effects. If they can dictate one prescription, they can take something from us tomorrow. They can take anything. So the future of medicine and the future of trust in healthcare is literally on the line. And the more and more, as we get into fighting back here, the more and more that you can draw those connections for people, that it doesn't stop here. It will not stop until that we are robbed of all of our rights and access to healthcare. The more of a coalition that we can build, and the better position we will be to fight back. So I know this past year has been heavy. We've witnessed these attacks on healthcare and freedoms and even our right to exist, essentially. They have started to say some of the silent things out loud, that they simply do not believe that trans people exist. They think that any treatment for trans people should be classified as fraud, because if your identity doesn't exist, how can a treatment for that identity truly be efficacious? How can it be a real treatment if the condition doesn't exist? So for many of us, this has kind of felt a little bit like deja vu. The same old cruelty, the ways in which they tried to ban LGB people from teaching a few decades ago. It's the same sort of tactic. They're painting us as people who are predators. So that it feels like the same cruelty wrapped in a new dressing. So there are new bans, new threats, new executive orders, but once again, we've been here in many ways. We've built a lot of power in fighting back against a government that has tried to erase us. And importantly, every single day across the country, our people and our allies and the coalitions we've built are fighting back against Trump's agenda, and we are winning. First, we are winning in the courts. As I mentioned briefly earlier, whenever Trump signs an executive order aimed at stripping healthcare, banning gender affirming care, denying our communities research funding, our lawyers are filing suit and our organizations are winning injunctions. Just this year, and I'll get into this in a second, we filed a lawsuit against an executive order aiming to restrict gender affirming care, and we won. Many other organizations and many other legal battles have been won and are working in our favor to block the unconstitutional actions of this federal government. The second way we are fighting back is in coalition. As I said before, we know that LGBTQ plus rights do not stand alone. The same forces that are coming for trans kids are coming for immigrants, are coming for people of color, for women. And if we link arms across these coalitions, we are stronger and better situated to fight back. Because if their strategy is to divide us, ours must be to unite and resist. And when we do that, we multiply our power. So the third way we are fighting back is in the streets and in culture. So we are marching and protesting. We are out still celebrating Pride as an act of declaration, an act and declaration of resistance. And we refuse to be silent. We refuse to disappear. When we do that, we are essentially fighting that we are on the side of the oppressors who are aiming to do that for us. So really showing up and insisting that we exist and we have the right to exist is incredibly crucial in this moment as they are aiming to push us to the sidelines. The other way that we are fighting, the fourth way, is through policy and accountability. So we are tracking, we have many partners and organizations that are tracking all of the actions that the administration takes so that no one forgets. We're pushing forward our own vision and making sure that as they roll back access to information, that we are mining that information for the future. The last way that we are fighting back in many ways, and I'm going to go into very specific examples, but another overarching way that our movements are fighting back now is by defending the institutions that exist. We've seen the institutions like Harvard and Boston Children's and many others that are fighting back and refuse to bend. So when schools fight to keep their trans inclusive policies, we're standing by them and lifting them up. When there are cities and states that are fighting to maintain access to gender affirming care and protect the providers and patients in those spaces, we are lifting up those efforts and ensuring that they are lauded for those. And we are honestly lifting them up as examples for others. So this is how we turn isolated fights into a collective stand. So yes, the Trump administration has a playbook. They also have money and media and power, but we have something that we truly believe is stronger. We have each other, our communities, and also we have science and facts on our side. And it is so important that we continue to lift those up as cornerstones of our democracy. So I mentioned that we're fighting back in the courts. At GLMA, we're fighting back on many fronts, and those include the courts. So we are a organizational plaintiff. We have sued the federal government twice now. One, we have sued the National Institutes of Health, or NIH, over their unlawful terminations of grants related to DEI, LGBTQ plus health, trans health, as well as HIV services, treatment and prevention, and all of those, anything essentially that touches LGBTQ plus health and everything around it. So we sued the NIH over those unlawful terminations. They terminated hundreds of millions of dollars of grants in those areas. And we fought back in court and we received a preliminary injunction in this case to restore hundreds of millions of dollars in grant funding for research that was being undertaken by our members. So we sent our information, all of the research that was being done by our members that had been terminated. We sent that memo to the Department of Justice to reinstate those grants. And that is the next step we will see very soon. We also sued the federal government over the executive order aiming to restrict gender affirming care for those under the age of 19. We joined with our partners at PFLAG, that is the group that works with parents and family of LGBTQ plus people, and we sued on behalf of our members and their right to practice evidence-based medicine, essentially their right to not have to choose between their job and the health and safety, their job and their livelihood and the health and safety of their patients, especially trans patients. So we sued and also received a preliminary injunction in this case. This case, importantly, our injunction is a little bit narrow in that it only relates to the conditioning of funding for hospitals that I mentioned earlier. So that means other attempts like subpoenas, the weaponization of the FTC, and other attempts to restrict gender affirming care throughout the country, it doesn't block all of those efforts. So many institutions have still decided to capitulate and cease care. But importantly, there are places that are still standing up, and they're doing so on the back some often of this injunction that we received in the court, because it is unlawful to say that you are not allowed to receive, that your institution can no longer receive federal funding just because you provided care to one singular population. And there are some other ways that health professionals are fighting back right now. First, of course, we know that state attorneys general have issued lawsuits defending the rights of providers to provide that care. We know hospital systems are refusing to capitulate. That's Boston Children's and many more. And we also know that there's a lot of provider advocacy taking place, both internal advocacy. So I hear from providers every single day that they're fighting back within their own institutions and advocating, going to their legal departments and administrators and saying, we need to continue to provide this care. Here is the injunction and court order that was sent down regarding gender affirming care. We also know providers who are quitting in protest or deinstitutionalizing so that they can continue to see their patients despite what their hospital system says. And importantly, health professionals are using their voice more than ever right now to mobilize. They're mobilizing during comment periods, because many federal regulatory processes, they require that they open up a comment period from the general public. So health professionals are using their expertise and sharing patient stories, of course, de-identified, to hopefully provide more information that will better inform the policymaking at that level. And there's a lot of media engagement going on, of course, from organizations, but also from providers, detailing the terrible effects of these regressive policies on their patients as well as themselves. So we work really hard at GLMA to get the provider voice into the media, their expertise, yes, but also their experiences in this environment. The constantly changing legal landscape is a deterrent to entering the health professions and will continue to erode trust in our medical systems. And importantly, once again, one of the key pieces that we need health professionals to use their voice for is to widen out the harms. That means we need everyone to know how these restrictions will harm the general population. If we set a precedent that allows the government to restrict care based on ideology, not safety and efficacy of care, but ideology, they will not stop with trans people. And the persecution of providers simply for doing their job will continue to erode the infrastructure of America's healthcare system. So I may have on occasion in the media evoked The Handmaid's Tale and other dystopian worlds, but that is because in those spaces, as well as like in every single rise of every single documented rise of authoritarian regimes, they often start with the experts, the scientists and doctors. They are the canaries in the coal mine as we descend into authoritarianism. If they are being prosecuted, it is because they want the general population to no longer trust in institutions and expertise and in healthcare and in science and evidence. They want to be able to say anything they want and never have it challenged. Another opportunity for folks to fight back right now is simply to stay engaged and keep learning. There is a crucial moment that we're in right now as they're even trying to limit access to continuing medical education. So keep learning and stay informed, stay engaged. You can do that through GLMA, through any of our partners, even by attending this virtual conference. You are doing your part to stay engaged and continue to learn. By becoming a member of GLMA as well, which I'll get into a little bit as well a little later, but you will have access to near like an incredibly comprehensive catalog of on-demand CME, CE, and CEU credits that are all about increasing cultural competence for LGBTQ plus people. Also, as I mentioned, our conference is coming up in about 2 weeks. If you can make it to Minnesota, highly recommend. This will be the largest conference in GLMA's 44-year history. So we are making history once again. And that is a crucial piece of resistance in a time where our access to healthcare, our access to gender affirming care, our access to comprehensive health education is under attack. And if now you have heard all of these ways in which we are fighting back, and you've heard more about the moment we are in and how crucial it is that we protect the last remaining rights and protections we have under this federal administration. And if you've heard all of this and you're still trying to figure out exactly where you fit in the fight, just please remember how important your voice is as a health professional. If you would like to expand your impact, one important facet is to consider first your spheres of influence. As a health professional, you have a number of ways in which you can affect change. We know that your family, your extended family, and immediate family, your patient, your community, as well as your patients and clients rely on you for expert information. That's the folks who are texting you for mental health advice, for all of the ways in which you show up as a therapist and as a health professional, therapist, social worker, or any type of provider right now. Use those opportunities to continue to use your voice and provide expert information on the state of healthcare for LGBTQ plus people. You can also do so in your institutions to build alliances across different departments and also with leadership and decision makers within your institutions. Continue to advocate for your own position in that space so that you can continue to build power. Also, getting involved in health professional associations. I mentioned our involvement with the AMA and the APA and the AAPA and all of those, but utilizing your voice and your professional affiliations to enact change and to build out and broaden your voice is really crucial. So getting involved now and using your expertise to drive better policy and decision making and comments from these health professional associations and other organizations that have a powerful voice is really crucial. And then both at the state level and federal level, there are many opportunities for health professionals to provide expert testimony in state legislative hearings, the state judiciary hearings, and medical board hearings. And that exists both at the state and federal level. And if you would like to get involved in those spaces, one of the best ways to do so is to get involved with GLMA. And this is a space in which, one, you can connect with a larger movement of folks who are fighting back for LGBTQ plus health equity. But this also means that you'd be availing yourself to a wide range of trainings specific to health professional advocacy. So very specifically tailored to allow you to use your voice, your unique lived experience, your unique expertise, training, and education to drive systemic change. And we hold these trainings very, very often, and we're able to connect people with real, actual, tangible opportunities to use that training. Just a few weeks ago, we connected one of our members with a opportunity to testify in front of a state legislative committee. So that means we got a call that said, do you have a health professional who's available to go to Baton Rouge to go and talk to this committee? And we said, absolutely, sent them. And they had already received training through one of our major training modules, so they were ready to go. If you would like to receive that training and then also be connected to real opportunities to utilize that training, joining GLMA is a great opportunity for you to maximize your impact. But to close out before we go into the question part, I want to make sure that we touch upon this one key truth of this moment. It is that our struggles are interconnected. The fight for LGBTQ plus equality cannot be separated from the fights for racial justice, reproductive freedom, immigrants' rights, and disability justice. These are one and the same struggle: the struggle for dignity, for safety, and for self-determination. So our liberation is undeniably a collective struggle. History teaches us that we cannot fight for liberation alone, and that when we stand together, our liberation is bound together. So when we stand together, we will eventually find freedom for all of us. But they will try to divide us. We know that. They have already tried to pit us against one another. Parent versus teacher, immigrants versus workers, LGBT people against trans people. Division is their strategy because when we are divided, we are weakened. But when we stand together, we are unstoppable. So coalition work is what makes us resilient. So I am tasking everyone here to resist the urge, resist their playbook, and continue to stand together. Resist the urges to scapegoat other communities, to turn your backs on our allies, and instead, let's bring us all closer together. So when we build bridges, we can resist division. When we choose solidarity in action, we are actually choosing a future where we can all thrive, not just survive. And when we stand side by side, we're not just resisting, but we're creating this possibility for a future where joy injustice and liberation belong to everyone. And that starts right here as we are tested in this moment. So with that, I will stop in and I'm happy to answer any questions with their time remaining, but please do reach out if you have any other questions. If you would like more opportunities to plug into opportunities to get involved, please reach out or sign up for our membership or join us in Minnesota in a couple of weeks. But I'll pause there and open up for questions.
Okay, Alex, it does look like we have at least one question. Are there any organizations that unify the targeted groups?
One sec. Absolutely. I think there are many organizations that unify targeted groups. The one that I look to often is the ACLU. The ACLU defending all of our civil liberties. They know that those things cannot be divided. But I would say that there's no one individual group that is just looking. I mean, ACLU, of course, is defending all of our civil liberties. But what I think is most inspiring right now is that there's been a real sea change from where we were maybe 10, 15 years ago, is that most organizations and most LGBTQ plus organizations are no longer thinking of our struggle as a siloed singular struggle, and that we have brought in far more coalitions. I know, for instance, like the Transgender Law Center works very closely with immigrants' rights and immigrants' justice. I know that LGBTQ plus community centers now are working against and working for their immigrant and migrant populations as well. I also know that we're like our organization, for instance, we understand that LGBTQ plus health equity cannot be achieved without racial equity in healthcare. And so we work really closely with some of the other health professional organizations that are working to dismantle the racial injustices that still plague the medical systems. So I would say there's not one singular organization that is all progressive causes all looped together, but I will say there is a very, very, very strong uniting factor across all of the LGBTQ plus organizations. That is, we cannot be separated from other causes, from other populations that are under attack right now.
Awesome, thank you. We also, there was a thoughtful comment from an attendee who stated they're here to become a stronger ally and supporter of the LGBTQ plus community. However, I think they feel a bit overwhelmed by the conversation based on their own political leanings. So for people who are genuinely trying to learn and increase their support, but are struggling to find their place, what advice do you have for them to stay engaged and navigate those feelings of discomfort?
Yeah, it is such a good question. And honestly, I think it's really brave to even start to acknowledge your own discomfort in the space. This is where, in many times, like we have, unfortunately, sometimes in progressive movements, defaulted to this sort of to this like purity test, as if you are not perfect, if you are not PC enough, if you don't know all the right terminology, then you're not really a part of our movement. And we need to cast all of that out. There should not be a purity test to participate in bound liberation and the struggles and to fight back against a rising authoritarian regime, essentially. So, what I would encourage is folks in this space who feel maybe a little bit vulnerable, a little bit that they don't know the right thing to say, or they don't have access to all of the information they might need, is to continue to keep learning, and to approach everything with curiosity and with empathy, and to always lead with that vulnerability. If you come into a situation and say, I don't think that I know enough, but I'm here to learn, that's very different than coming into a situation and saying, I know everything, prove me wrong. Those are very different approaches, and one of them is going to ensure that you're met with a lot of resistance. The other is going to be met with empathy and compassion, and to call people in. So I'm a big proponent of calling people in. I like to build alliances with folks who might not agree with me on everything. And also, the only place where I know that I will not build an alliance with someone who disagrees with me is if they disagree that I don't have the right to exist as a non-binary person. If someone's challenging our rights to existence, that's a different playing field. I would also say for folks who may be encountering people who are less comfortable in this space, but they're genuinely trying to learn, but they might not know all of the right terminology, is that you can work with these people because we have a lot of shared values. So rather than approaching with this idea that you need to educate someone, first learn about them, learn what their values are. Uh, and then unite on those. One common thread that I see utilized very often right now, because a lot of people have been misled by depictions and statements in the media about trans medical care for young people. So gender affirming care for minors is this really divisive topic right now because the right has put a lot of undue attention on it. So there's a lot of misinformation out there. But what I've seen is a really powerful tactic to build up and to counter mis and disinformation is to unite on shared values. So when someone comes to me and they've clearly, unfortunately, been exposed to a lot of mis and disinformation on gender affirming care for minors, the first thing that I say is, you know what? It sounds like you really care about young people and their rights to healthcare, and you really care about the safety and well-being of young people. So do I. Here are some of the ways in which gender affirming care for minors actually supports their health and safety and well-being. And here are the ways in which restrictions undermine that. So uniting first on that tells them that we are actually on the same side. We are joining together. And that same thing can be said for almost every single progressive cause. I hear you that you care about X, so do I. So there's a few ways in which we also continue in this kind of training through for GLMA members. So again, really encourage folks to work with us and to continue to develop those skills.
Awesome. Alex, you had also mentioned there's a conference. I may have missed it, but did you provide information on that? You were talking about it. You can still register.
Yeah, absolutely. You can still register. I can actually drop that in the chat right now. But if you go to our website, it is under, you can see all of our educational opportunities there, but I will drop the link to this in the chat. And once again, this will be the largest conference in our history, and we will have hundreds of health professionals of all different disciplines there. So please consider joining us. It will be a fantastic conference.
Awesome.
And
I do.
I see one more question in the chat. Did you want me to answer that one as well?
Sure.
Great. Yeah, I really appreciate the question and talking about the science and everything that underpins all of our advocacy. So it would be a little bit difficult for me to go through all of that key information, but I'm going to put another resource in the chat here. So this is a link to all of our policies and position statements. These are developed by our membership, again, a multidisciplinary membership of experts in LGBTQ plus health in all areas of health. And we have a policy and government affairs committee that works pretty tirelessly to underpin all of our policies and positions that we advocate for and also defend against. That is underpinned by all very, very rigorous science and evidence. So if you go to that link that I just dropped in the chat, you can search all of our policies and positions, and all of those, some policies and position statements are just simply articulations of where we stand. And then many of them come with very rigorous, like very lengthy citations and references cited so that you can see some of the science and evidence that informs our advocacy.
Awesome. Thank you so much, Alex.
Mhm.